If you are over 60, your legs and feet may be telling you things your heart, blood sugar, nerves, or circulation have been trying to say for a long time. And many people miss those signs because they seem small at first. A little swelling at the end of the day. A foot that feels colder than the other one. A sore that takes too long to heal. A cramp while walking that goes away when you stop. These do not always mean something serious, but they are never something to brush off. The truth is, your legs and feet can give early clues that the rest of your body needs attention, and the sooner you notice them, the more choices you usually have. I want to talk about this today because so many older adults focus on blood pressure, memory, sleep, or blood sugar, and those things matter. But the legs and feet are often where trouble first shows up. They carry your weight. They help you balance. They help you stay independent. And when something changes there, it can affect everything from walking across the kitchen to getting out of bed safely at night. Here's the part many people miss. You do not have to wait for severe pain before paying attention. Some of the most important warning signs are quiet. One common mistake is thinking leg and foot problems are just part of getting older. Yes, aging changes the body. But pain when walking, numb toes, new swelling, burning feet, color changes, or wounds that do not heal should not be ignored. I once speak to many families who say the same thing. We thought it was normal. We thought it was shoes. We thought it was just age. Then months go by, and the small problem becomes a much bigger one. That is why paying more attention to your legs and feet is not about fear. It is about staying steady, active, and in control. And if this topic matters to you, let me know you're here. You can subscribe for more simple health guidance, and in the comments, tell me your age or the one change in your legs or feet you've noticed lately. Maybe it is swelling, cramps, tingling, or foot pain. If you are caring for a parent or spouse, you can share this with them too, because sometimes one gentle conversation can help someone catch a problem earlier. Now let's make this simple. The first thing to watch for is swelling. A little puffiness after sitting too long can happen. But regular swelling in the feet, ankles, or lower legs deserves attention, especially if it is getting worse. That matters because swelling can be linked to circulation problems, vein problems, side effects from some medicines, kidney issues, or heart strain. If one leg suddenly becomes much more swollen than the other, or the area is painful, warm, or red, do not wait it out. If swelling comes with chest pain, trouble breathing, or sudden shortness of breath, get urgent medical help right away. That kind of swelling needs quick attention. The second sign is pain in the legs when you walk. Many seniors tell me, my legs ache when I move, but when I stop and rest, it gets better. People often blame age or arthritis, and sometimes that is part of it. But sometimes it can point to poor circulation. In simple words, the muscles may not be getting enough blood flow during activity. If walking brings cramping, tightness, or heaviness in the calf, thigh, or buttock again and again, especially if it improves with rest, that is worth bringing up with your doctor. It is one of those hidden signs many people miss. The third sign is numbness, tingling, or burning in the feet. This can feel strange, and some people try to live with it for years. But nerve trouble in the feet can raise the risk of falls because you may not feel the floor clearly. You may not notice a blister, a cut, or a pebble in your shoe. This is especially important if you have diabetes, pre-diabetes, back problems, vitamin problems, or if you take several medicines. When your feet cannot talk to your brain the right way, your balance can suffer. And that can quietly steal confidence. You walk less. You leave the house less. Your world gets smaller. So please do not ignore changes in feeling. Now this is important. Look at the color and temperature of your feet. If one foot looks pale, bluish, darker than usual, or feels much colder than the other, that is not something to shrug off. The same is true if your skin becomes shiny, your leg hair seems to thin out, or your toenails change in unusual ways. These signs can happen for different reasons, but one thing they may point to is reduced blood flow. Your feet need good circulation to heal, stay warm, and stay healthy. Here is another sign that deserves real respect. A sore, cut, blister, or crack that is not healing. Many people, especially those with diabetes or numb feet, do not feel small injuries right away. Then the skin breaks down, infection can move in, and what started as just a little spot turns into a serious problem. If you notice drainage, a bad smell, redness spreading around a wound, warmth, fever, or increasing pain, get medical care promptly. And if you have diabetes, daily foot checks are one of the smartest habits you can build. But there is another reason seniors should pay more attention to their legs and feet. They are deeply tied to fall prevention. If your feet hurt, if your toes grip the floor because you feel unsteady, if your shoes slip, if your ankles feel weak, your body starts making tiny changes to protect itself. The problem is those changes can make falls more likely. Shorter steps, slower turning, holding onto furniture, avoiding walks, loss of leg strength. So when your feet feel off, it is not only a foot problem. It can become a whole body problem. That brings me to one of the most practical things you can do, and I saved this part because it helps more than people expect. Give your legs and feet a 1-minute check every day. Not once a month. Every day. Look at the tops and bottoms of your feet. Look between the toes. Check for redness, swelling, cuts, cracks, blisters, and nail changes. Notice whether sock lines are getting deeper. Compare one foot to the other. If you cannot see well, use a small mirror or ask someone you trust to help. This tiny routine can catch problems early before they become painful or dangerous. Your shoes matter more than many people realize. Tight shoes, slippery soles, worn-out slippers, or walking around in socks on smooth floors can create real trouble. Choose shoes that fit well, hold the heel steady, and do not squeeze the toes. If a shoe rubs, do not break in the pain. Pay attention to that pressure point. And before putting shoes on, take a quick look inside. A wrinkle, rough seam, or small object can injure a foot that already has reduced feeling. Let's talk about cramps for a moment, because many older adults deal with them at night or while walking. Cramps can have many causes. Sometimes it is overuse. Sometimes dehydration. Sometimes not moving enough. Sometimes low minerals. Sometimes medicine side effects. And sometimes it is circulation. If leg cramps are becoming frequent, very painful, or new for you, it is worth reviewing your medicines and health conditions with your doctor or pharmacist. Do not stop a prescription on your own, but do ask questions. A simple medication review can be very helpful, especially if you take pills for blood pressure, fluid control, cholesterol, or diabetes. And while we are here, please do not forget the skin itself. Dry, cracked skin on the feet may look harmless, but cracks can open the door to infection. Wash gently, dry well, especially between the toes, and keep the skin moisturized unless your doctor has told you otherwise for a specific condition. If a foot becomes red, hot, swollen, and painful, especially with fever or chills, seek care quickly. Skin infections in the foot or leg can worsen faster than people expect. If you want a simple list of questions to ask your doctor at your next visit, here are the kinds of things I would bring up. Why are my feet swelling? Could my leg pain be from poor circulation? Are any of my medicines making cramps, dizziness, or swelling worse? Should I have my feet checked because of diabetes, numbness, or balance problems? Do my shoes support safe walking? Those are smart questions. They are not dramatic. They are protective. Please also listen to your body when symptoms are sudden. If you have sudden one-sided leg swelling, severe pain, a cold or pale foot, new weakness, fainting, chest pain, trouble breathing, or sudden confusion, do not try to solve that from a video. Get medical help right away. Fast action matters. The good news is this: small changes in your daily routine can make a real difference. Notice your feet. Move your legs often if you sit for long periods. Wear safer shoes. Check your skin. Pay attention to numbness, pain, swelling, and wounds. Ask for help sooner instead of later. These are not huge steps, but they protect something very big: your freedom to move through life with confidence. Your legs and feet do a quiet job every single day. They carry your weight, your routines, your plans, and your independence. So if they have been sending little signals, please do not ignore them. Start with one simple step today. Take off your shoes, look closely at your feet, and notice what they may be trying to tell you. And if this helped you, subscribe and share it with someone you love, because one small sign noticed early can lead to a much safer tomorrow.